Bangladesh is now facing a fast-growing measles crisis. Since March 15th, deaths from measles and measles-like symptoms have risen to 311, with 17 deaths reported in just 24 hours till May 4th, the highest single-day toll so far. Today, on May 5th, another 6 children died. Confirmed cases have reached 5,726, while suspected cases stand at 42,979, according to the DGHS. So how did a disease that can be prevented through vaccination return with such force? Was it only vaccine hesitancy? Was it a procurement failure? Did testing delays make things worse? And why are children in slums, remote hill areas, and poor communities paying the highest price? Let's break it down in today's Star Explains. The World Health Organization has assessed Bangladesh's national risk from the ongoing measles outbreak as high. By April 25th, WHO said the outbreak had affected 58 of 64 districts across all 8 divisions. At that point, children under 5 made up 79% of reported cases, with infants and children under 2 among the worst affected. The situation has since worsened. As of May 5th, confirmed and suspected deaths have reached 317, with cases reported from across the country. Measles is one of the most contagious diseases. It spreads through droplets when an infected person coughs or sneezes, and the virus can remain active in the air or on surface for up to 2 hours. One infected child can transmit the virus to 18 to 20 others. That means even a small fall in vaccination coverage can create a large pool of vulnerable children. Bangladesh's MR1 coverage fell from 96.61% in 2024 to 92.73% in 2025, while MR2 coverage dropped from 96.15% to 90.78%. For measles, experts say coverage needs to stay at or above 95% to preserve herd immunity. According to a report by the Daily Star, experts and officials blamed the crisis on procurement delays, vaccine shortages, stockouts, routine immunization gaps, and the failure to hold a special measles campaign that had been due in mid or late 2024. WHO also linked the crisis to MR1 and MR2 vaccine stockouts between 2024 and 2025, routine immunization gaps, and the absence of a nationwide supplementary campaign since 2020. Former health advisor Professor Saidur Rahman, however, claimed there had been no alert, warning, or red flag from any national or international authority indicating an urgent need to conduct the special measles campaign immediately. He also said the current campaign is using MR vaccines approved under Gavi's decision letter from March 2025. Vaccination prevents outbreaks, but testing helps identify and treat cases quickly. An editorial in the Daily Star noted that the Institute of Public Health in Dhaka was receiving around 300 samples a day and had the capacity to test 300 to 400 samples daily, but could only test 120 because of a shortage of testing kits. It also said IPH was the only public organization testing measles samples, meaning samples from outside Dhaka had to be sent to the capital. That delay matters. When diagnosis is slow, isolation is delayed, treatment is delayed, and the disease gets more time to spread. Children are the most vulnerable, especially those under 5. And the risk is even higher for children who are unvaccinated, malnourished, living in crowded settlements, or living far away from healthcare. In Dhaka, WHO said the cases were concentrated in densely populated informal settlements, including Damra, Jatrabari, Kamrangirchar, Korail, Mirpur, Tejgaon industrial areas, and slum clusters. In Bandarban's Ali Kodam, at least 5 children die with measles-like symptoms in remote Mro villages where families struggle to reach hospitals because of distance, rain, helipads, transport costs, and poor access to routine healthcare. WHO has called for urgent action, at least 95% coverage with both doses for the measles vaccine, stronger surveillance, faster case detection, and of course, rapid response. Bangladesh has already started a nationwide measles rubella vaccination campaign targeting around 1.8 crore children aged 6 months to 59 months. But experts say the campaign must reach the children who are usually missed: those in slums, remote hill areas, Chor regions, poor households, and communities with limited access to health workers. Measles is not a mysterious disease. It is preventable, it is known, and it is stoppable. But the outbreak has exposed something larger than a virus: gaps in vaccination, delays in procurement, weak testing capacity, fragile surveillance, and the distance between healthcare on paper and healthcare in people's lives. The question now is not whether Bangladesh knows how to stop measles. It does. The question is whether the system can move fast enough, reach deep enough, and care enough before more children are lost to a disease they should never have had to fear.